Whether to really manage the pain. But if I could ask you, is it curable or is it more about managing the pain?
Cure in rheumatism, most of the rheumatic diseases we can't cure. This comes under non-communicable diseases. So you can control the symptoms, and in fact you know very well that advancing age, no one can prevent that. And the changes you get in the body, wrinkles in the skin, and similar changes happening in the joints also. So there's no regeneration of the cartilage. So we have to protect the cartilage from getting further damage. So there are certain therapeutic techniques, physiotherapy, heat and cold cryotherapy, and with medicines we can control to a certain extent. But at the same time should not forget about the disadvantages or the side effects of the long-term drugs or the painkillers.
So actually when people do go for painkillers and things, we'll speak about those interventional drug treatments as well later on. But if we go on to another type of rheumatism, which is rheumatoid arthritis, what's the difference between osteoarthritis and rheumatoid arthritis?
Yeah, actually rheumatoid arthritis is an inflammatory disease, whereas osteoarthritis is a degenerative disease.
I see.
So in the inflammatory disease, that can occur at any age. Now we see patients, children with rheumatoid arthritis or any age, but it's common in the middle age, and also it's commoner in the females.
So I think we have to go for our first commercial break, but we'll be right back and we'll be speaking about rheumatoid arthritis. Now arthritis is something that is so common, and we know, I know so many people who are suffering with the disease as well. So I'm sure you would like to know more information about it as well. But before we go, I have to remind you to like us on our Facebook page. That's www.facebook.com/goodmorningsrilanka. And you can also send us your feedback at mtvsports@maharaja.lk. So we'll be right back after the break. Stay with us on Good Morning Sri Lanka. Good morning Sri Lanka, you're with me Amaya on the show, and if you missed the first segment, today we're speaking all about rheumatism and different diseases that come under rheumatism. I'm learning a lot on the show, definitely, and to give us some advice we have 3 doctors with us, 3 specialists in rheumatology, and we were speaking before the break about rheumatoid arthritis, and we were speaking about the difference between osteoarthritis and rheumatoid arthritis. But let's speak about, you said that this is something that can affect children as well, and you see this happening commonly. So what are the symptoms that you can see in children, especially when it comes to rheumatoid arthritis?
In children, usually sometimes they may present as limping, unexplained limping, and parents may notice that and they bring their children to doctors. Sometimes they notice the swelling of their joints, especially the large joints. And again in children also there are different types of arthritis, and it's one type they are mainly affecting children, girls, and there's another type, the backache and neck pain affecting young males. So there are again different varieties in childhood arthritis also. Mainly they have pain, stiffness and loss of function in their joints. So,
but isn't this a very debilitating disease, because you said that rheumatism and arthritis is not exactly curable. It's something that has to be managed. Controlled. So when that happens in a child, what are the consequences that a child has to face while they're growing up and their bones are forming and all these things are happening? What are the consequences for their future when you have arthritis at such a young age?
Actually, the most important thing is to diagnose it at an early age, even in adults, because what happens in these types we call inflammatory arthritis. The body has white cells which are meant to protect us against foreign invasion from bacteria, viruses. They suddenly turn against the body and start destroying the cartilages in the joints. So in this inflammatory arthritis we use we call them DMARDs, or disease modifying antirheumatic drugs. These are not painkillers, because painkillers only take away pain. But these disease modifying drugs stop this attack of the white cell and prevent further cartilage damage. And if you start them early enough, they will not have any damage in the joints, And usually after a few years they do get better, and people don't have to take these DMARDs for years and years. But these DMARDs also come with their own set of side effects, so we have to monitor blood counts, liver profile. So when you have a disease like rheumatoid arthritis, you'll have to take these tablets and you'll be monitored with blood reports. But if you take this properly and if you are monitored properly, the disability will be minimal. Actually, disability comes when patients are not managed properly.
I see. So they can lead normal lives and go about all of their daily work.
They can lead. I mean, there are people who are doing sports who have arthritis. So you can live a completely normal life, but it's very important that it's diagnosed properly and treated properly by a doctor who knows how to treat these diseases.
Of course. And if we speak about arthritis later on in life, especially in the elderly, what are the repercussions then when you have arthritis at that age? Because that is very common. Arthritis is a common disease among the elderly population. So how would you deal with that?
Actually, even in adults, you can get rheumatoid arthritis, but it's osteoarthritis is common. So to prevent it getting worse and worse with time, because you can't change your age, one thing which is very important is the body weight. And the degeneration occurs mainly in the hips, the knees and the ankles, mostly the knees,
so
because of the weight-bearing joints. And also the occupation. If constantly they cause injuries, minor injuries to the joints, so the occupation is very important.
And I think we have some images as well of someone who has arthritis, and you can see the inflammation in the fingers. But Dr. Panangala, I'm sure that there are ways that you can prevent it as well. And how can you prevent arthritis from happening in your life? Besides controlling weight?
You have to control the weight, and exercise is very important, especially the knee joint exercises. Those are pictures of some of the patients with rheumatoid arthritis. There you can see the characteristic pattern of joint involvement. Sparing the distal joint, the other joints in the hands are affected, and due to this advanced disease they get deformities. So in the X-ray also there you can see the joints are deformed and they are not in the normal position, and there are some erosions in those X-rays. Those are a patient with rheumatoid arthritis.
But these are very advanced cases.
Very advanced stage, yes. And if you don't, nowadays we don't see that much of deformities because we treat them, we detect them early and treat, and we can prevent progression.
Of course.
I think since the 1980s when the new drugs came in, now we see only patients before that era. Now properly treated you will never end up like that.
I see. So there is, it's a pretty positive environment that you go into now when you go into a hospital and you meet a rheumatologist. There's always something that you can do to really prevent it from going into that advanced stage that we saw.
Yes, it's very important, and I think even in old age when you have osteoarthritis, we always encourage to continue the lifestyle and exercise. I think along with weight reduction, exercise is very important, because we can't do anything for worn out cartilage, but what we can do is we can strengthen the muscles around that joint. So we use a lot of physiotherapy coming from sports medicine to strengthen muscles and also correcting postures to prevent further damage, and this allows people to live a normal life and minimize the disability.
Of course. So that's good news for everyone to hear, I'm sure. But moving from arthritis to ankylosing spondylitis. Now this is not something that I am very familiar with either, so if one of you could elaborate about what exactly this disease is.
Yeah, this is actually mainly a disease of young males, again genetically determined disease, and it's mainly involving the axial skeleton. Axial skeleton means the spine mainly, and the hip joints and the shoulder joints. So they initially present with backache, non-specific backache, and they find it difficult in moving around the bed, especially in the morning.
I see.
That is called morning stiffness actually. Almost all inflammatory arthritic conditions, this morning stiffness is a very characteristic feature. And in ankylosing spondylitis also, the first thing is they very difficult to get up in the morning, and they have severe backache in the morning, but as day goes by then they feel better, and with exercise they feel even much better. And I have some pictures, I think, person with ankylosing spondylitis. Yes,
we'll try to get them on screen as well. But you spoke about how this will affect young males. right? So how can they deal with this, and if it's a symptom that young males out there should look out for, is it because is it a very prevalent disease?
Again, if person is having long-standing backache, I think especially young males, they should go and consult a doctor and get the correct diagnosis. That is very important.
We have X-ray as well coming up, but you go on, doctor. You can just
then we can the diagnose. There are some specific blood tests also available.
Oh, there we go.
You can see the X-ray of a spine, and the characteristic features it's like a bamboo. You would see.
So
this is called bamboo spine.
Okay.
All these ligaments and surrounding soft tissues are calcified, and the spine is very straight. In normal persons, if you do spine X-ray, it's not like that.
Of course.
These are patient with ankylosing spondylitis, having the straight spine, and the mobility of the spine is very much restricted.
So that sounds like a very bad disease to have, because I mean, once the tissues around it are calcified, I'm sure it's something like stiffening up.
Yes.
So how can you prevent that? Is it if it's genetic? Can the parents look out for it in their children?
It starts very young, around 18, 20, 25, that time.
I see.
So I think main thing is to diagnose it early. And then in the initial stages you give the painkillers and then the DMARDs, and also physiotherapy is very important. They must do exercises every morning, breathing exercises and other exercises to keep the mobility of the spine. And once you have diagnosed, you have to treat them very early. And at present there are certain drugs which we call biologicals, which are very effective for this condition. And so if you go to a rheumatologist and he diagnoses this, I think best thing is to have one of those drugs, so that you will get almost 100% recovery before they develop any deformities. But only drawback is that it's a very expensive drug. So if you can get through the hospitals, you can get it free, but it's very limited quantity.
I see.
And if you do it outside, it costs about 200,000 for a course of treatment.
Oh, I see.
And swimming is a very good exercise for ankylosing spondylitis. And we encourage patients to practice swimming, and at least twice a day per week they should go for swimming. That is very good exercise for this ankylosing spondylitis.
But I'm guessing that something like swimming is actually good for any type of
kinds of
bone or joint disease, isn't it? Because you have the buoyancy of the water coming in there. All right.
So when you speak about exercise, swimming is a non-weight bearing exercise, where the body weight is taken off the bones. So if you have advanced arthritis, it's very good. But things like walking, weight training exercises are also encouraged, weight bearing exercises to strengthen the bones and the muscles.
Alright, so before we go for the break, I quickly want to ask you to just give a summary about what psoriatic arthritis is, and what this disease does to your body.
Psoriatic arthritis also is an inflammatory arthritis, where the body cells turn against the body. In this disease, it comes with a skin rash, the psoriatic rash, where you have seen the typical psoriasis. You get red colored like plaques on your skin, and then in the hair also you start getting these plaques with a lot of scales coming off, and you get changes in your nails. Along with these changes, you get involvement of the joints, the knees, the spine, the neck, the hand joints, and all these arthritis have the typical feature where the pain is worse in the morning. For about 1 hour you feel really stiff in your back, your neck, your joints feel really bad. And psoriatic arthritis also untreated. We use a similar treatment to ankylosing spondylitis. Similar treated, it can be very debilitating, but if you treat very early, both the skin and the joints can be saved.
So then it's all about treating the disease early.
It's all about diagnosing it very early and treating it properly. Properly monitored treatment has shown to minimize disability.
I see. So we have to go for a short break, but we'll be back with these doctors. Before that, I have to remind you about Facebook. www.facebook.com/goodmorningsrilanka is where you have to go like us on our page and stand a chance to win MTV merchandise. And we'd also love to hear from you and give us your comments about the show. And you can also email us at mtvsports@maharaja.lk. So stay with us on the show. We'll be right back on Good Morning Sri Lanka.